And welcome back to the Morning Brew. I'm Larry Aarons. Our guest co-host this week is Greg Mays. Going to concoct a couple of Halloween cocktails for you here in a few minutes. He's the managing editor of simplecocktails.com. This is Physical Therapy Month, and we're going to have our friends from Lovelace over, and we invited Randy Clark to join us. Randy is Director of Therapy Services at Lovelace Rehabilitation Hospital. Welcome to the show.
Thank you.
And Lara Wenger is here. She is Outpatient Therapy Manager at Lovelace Rehabilitation Hospital. And you have a different specialty, don't you? Your speech and voice therapy, right?
Correct, yes.
Good, maybe you can help us.
Maybe.
Glad you're both here, and Physical Therapy Month. You're both in the same field, but have different specialties here.
Correct.
Fill us in on what Lovelace Rehabilitation Hospital does in general.
Okay. Basically, we offer therapy services for both inpatients and outpatients. So we actually have a 62-bed freestanding rehabilitation hospital not far from here. We're CARF accredited. And we actually see patients in the hospital who have had strokes or traumatic brain injuries, spinal cord injuries, hip fractures, as well as like total knee replacements. And those patients actually get intensive therapy at least 15 hours a week. And we also offer outpatient therapy services as well. Some of those services can include balance testing and training, wheelchair assessments. We have a very robust therapy pool where we offer community pool classes. We can actually do therapy in the pool as well. And we also do fall prevention.
Oh, very good.
That's
I'm
great.
going through a lot of that with my dad right now.
Are you?
I've never had physical therapy myself, but I just went through a whole bunch of that with my father, who's going to be 91 in a couple of weeks. And he's been a risk for falling, and it's been very interesting to see the therapists deal with that and work on balance and things like that.
Right.
And so I've gotten a new appreciation for the kind of work that you do in that area.
Good.
I really have. Let's talk about you a little bit, Lara. You probably work with a lot of stroke patients, don't you? That's a side effect of a stroke sometimes, where people lose their speech, and you have to start all over.
Yep, it's true. And we offer just a wide range of services from ages 3 all the way till, people, elderly population, for different diagnoses, including things like a stroke or any neurological impairments, traumatic brain injury. For the younger kids, we do developmental therapy for speech and language impairments, and then we also do voice and swallowing therapy. So we have a wide range of services that we offer for all ages, really.
Very nice. Tell us about the benefits in general of physical therapy.
Well, really what we try to do is we work collaboratively with our patients. We do individual assessments, and then based on whatever is bringing them to the hospital, we try to establish some goals. We try to reduce pain, which is the number one thing, and then we also try to either restore their mobility or improve their mobility so they can then participate in those activities that they're not able to participate in currently. Depending on the situation, sometimes physical therapy can be an alternative to surgery, depending on what the situation is.
Sure.
With that. And also we try, if we can, we try to prevent the loss of mobility by providing a wellness program that can lead to a healthier lifestyle if we can do that before injury or illness sets in. So,
in a lot of cases, Randy, and I saw it firsthand, the physical therapy, there's a lot of physical involved with the therapists themselves. I mean, they have, it's a tough physical job to do this.
It is, yeah. It's one-on-one therapy. You're gonna be with your therapist the whole time. There's a lot of homework for the patients. We want patients to participate at home as well. In today's medical environment, we don't get as many sessions with patients as we used to. And so the sessions are very intensive when they're...
I saw therapists holding people up and catching them. And
sometimes it takes 2 or 3, depending on how involved the patient is.
Yeah, amazing. The services have a range here, and that's why you're both here. I guess the question I have is, what predominantly is the physical therapy need that you see the most? Is it the physical part, or is it the speech part?
Oftentimes they go hand in hand, so we have a multidisciplinary
see.
approach for inpatient and outpatient. We have speech therapy, occupational therapy, and physical therapy, and just depending on what the diagnoses are associated with what they're coming in with, then we have all three disciplines work with patients, or maybe sometimes it's just speech, sometimes it's just OT. But if they're an inpatient, they're typically receiving 2 to 3 therapy services a day, up to 3 hours, well, a minimum of 3 hours a day.
It's a workout.
Yeah, and in the outpatient realm, we have the downtown hospital, and then we have outlying clinics in Santa Fe, Jemez, Rio Rancho, the Northeast Heights, and downtown. And they're all very busy, and in the speech realm, we wanted to mention our voice lab, because a lot of people don't even know that speech therapists address vocal impairments, swallowing impairments. We have a fully equipped voice lab with specialized equipment. We do laryngoscopy and endoscopy, where we will look at the vocal cords, use imaging for biofeedback. And with school underway now, one of the greatest populations of people who abuse their voices and have difficulty are the teachers. And so we see teachers and
Keeping order in the classroom.
Yeah,
You
yeah.
used to do that, right?
Yep.
That's interesting. So the services are, like you said, available both outpatient and inpatient. It's just a matter of what your physician recommends.
Exactly. We work under a physician's referral.
Yes.
And so if people have a condition where they feel like they would like some therapy, they can just visit with their physician, and they can either call us with a verbal order, they could fax over an order, and then we'd be glad to take care of them.
Always curious how you chose this line of work. How did you get into this?
Well, my personal story is when I was probably 2.5 years old, my sister was born, and she actually had a stroke when she was 14 months old.
Oh, my.
And so I kind of grew up taking her to therapy and never thought of another profession.
No kidding. Interesting
Yeah.
story.
Right, so that's kind of how I got into it. I've been a physical therapist for 32 years.
Wonderful. You've helped a lot of people.
Well, I hope so. They've helped me as well. It's a great
That's
great
good.
field.
It's a giving back thing. Laura, how about you? How did you get into this?
Well, I think I was interested in the healthcare field and helping people, and my strong suit was more in the speech realm. And I went to St. Joseph Rehab Hospital to do observation hours many years ago, and just fell in love with the profession, and went to graduate school after that. And I'm at the same hospital I was where I did my observations. So.
Oh, that's great. That's great. Well, if you want to know more about physical therapy, it is Physical Therapy Month. The folks at the Lovelace Rehab Hospital be happy to talk to you and see what options there are. And I know you consult with people all the time
Yes.
about how to get your life back.
Right.
And that's really what it's about, isn't it? Getting back to normal.
Right.
Yep.
Thank you both for being here.
Thank you for
Good to
having
have
us.
you on.
Yeah, thanks
Appreciate
for
it.
having us.
Yeah, and they're really close to work, so everybody at Lovelace, they'll be in early today. Thank you, guys.
Thank you.
Thanks very much. Randy Clark, who is Director of Therapy Services, Lovelace Rehabilitation Hospital, and Lara Wenger, Outpatient Therapy Manager, also at Lovelace Rehabilitation Hospital. We'll be back. You got an event coming up? You need somebody to help plan it? We got a pro for you next here on The Morning Brew.